Welcome back to the Health Commute. I'm Dr. Dan with Dr. Pascal. So today we're going to go over a few things that I think every patient should know. Really, what the title is, do you really understand the true meaning of health? And we want to cover the 10 things that we hope that every patient should know. But the reason why we're doing this is, for me, I also feel a little bit of a guilt factor, if you want to call it. We used to teach our patients in the office before COVID. We used to teach them different principles about health so they could truly understand how their bodies should really work. And to me, maybe it's just a personal thing, but I'm better able to follow through with something if I truly understand what I'm getting myself into and I understand how things work. So we would always want to teach our patients how their bodies are supposed to work so that they could then understand their role.
Absolutely, yeah. I think there's actually a lot of confusion about true health and health versus sickness, or even simply being healthy versus not being sick, right? And today we just kind of want to try and frame it, put some parameters around it to help people really understand exactly like you said, how our bodies were designed to work and what the true meaning of health really is.
And part of that is a little scary when I've seen patients over the years, and I think the one thing that I could see time and time again is the reason why people get into trouble is they assumed that they were healthy when they were truly weren't.
Yeah.
And where the definition there for them was, I am healthy if I feel okay,
yeah,
and I don't have major problems. So meaning that I could wake up every day, keep doing what I'm doing, eating the foods that I'm doing, being as active as I normally do, and then one day comes along and they have a terrible news. They have a heart attack, they have cancer, they have an injury, they have unexplained symptoms that are starting, but they were saying, I don't understand, doc. Before this, I was healthy. But really what they mean is I had no symptoms prior, and all of a sudden these symptoms showed up.
And sometimes even though the symptoms are considered normal, right? Like how many times have you heard, we'll ask people, do you have any other health concerns or health issues? And they say no, and then later on we come to find out that they have headaches twice a week, but those are just normal headaches, right? And so we start to understand breakdown of the human body as also being normal, right? So yeah, it's kind of a slippery slope when we don't understand things, and then all of a sudden you're right. One day you wake up with a more serious diagnosis, and you wonder, how did this just appear out of the blue? And oh well, I guess maybe we chalk it up to genetics, or I'm just unlucky.
Right.
Right.
And that's why we want to go over these 10, if you want to call it, points to just even spark a little bit of questions, maybe in terms of, for yourself, is like, am I doing enough to enable my body to function and heal well? But for that to happen, we need some parameters. And that's why we want to kind of cover these 10 points.
Well, so number one, Dr. Dan, is our body designed to be healthy or sick?
Right. And a lot of times that's, I just assume that people would know that, but yes, our body was designed to be healthy. We sometimes think, oh, well, this person's lucky or this person is unlucky. But when you really kind of go back to the beginning, like we were born, to be healthy. We were designed to be healthy. We became, 2 cells, from our mom and dad, and 270 days later, we are, this happy, healthy baby. We are designed to stay that way. And that's the way the body was intended. Think of it, I tell sometimes patients, let's say you build a computer or there's certain things that it's just designed to work that way. When it doesn't, that's when there's a problem, and you got to figure out what that problem is and correct it. But our body was designed to work well.
And secondly, so yes, we understand now our body was designed to be healthy. Is your body smart or stupid, Dr.
Right.
Dan?
This is always a big one for me. Why do we sometimes treat our bodies like it's stupid? Right. We do something, we're like, oh, my body doesn't know how to do it. I know better. I'm going to do this for my body, right? But what we really have to kind of go back to and understanding, no, our body is super smart. Probably, and what I say by that is our body is smarter than our educated brain.
Correct.
For the most part, right? And what I mean by that is, imagine, let's say, if we go both out for lunch, right? We have some food. And let's say there's some food poisoning that, the chicken, let's say, was undercooked, or there's salmonella, or whatever is going on. What would be a normal, healthy response, when you get home.
To the food poisoning.
Yes.
Your body wants to get rid of it.
Right.
That would be an intelligent, smart body response, is to get rid of that food poisoning so it doesn't cause more damage.
Right. So I think we could all understand that oh yeah, that's a normal response. But then our educated brain goes, well, I don't want to throw up. I don't want to feel, this pressure in my stomach. I don't want to have diarrhea. So I want to take something to minimize those symptoms and treat my body like it's stupid. But by minimizing what your body's trying to do, it actually makes the issue last longer, and it basically isolates the food poisoning in your stomach for a longer period of time. So we have to a lot of times listen to our body. Our body knows what to do and how to do it. We have to treat it like it's smart.
And if we treat it like it's stupid, we interfere with our body's natural ability to be healthy and function well.
Right. And the same thing goes for an injury. When our body goes through an injury, it could be a back injury, a neck injury, an elbow injury. The body knows how to, create that little bit of inflammation, to do the healing, to restrict motion so that your body can properly heal. We just have to understand what it's trying to do and not interfere with it.
Okay. So number 1 was we're designed to be healthy. Number 2 is your body is smart.
Yeah.
And number 3 is, well, that intelligence, so your body to be smart, Dr. Dan, what's the most important system in the body for your body to understand how to heal or how to respond to these problems that might arise?
Right. And I think for most people, maybe we understand that, okay, well, the brain controls these things. But I think we have to even take it a step further, because sometimes we don't really understand the magnitude that our nerve system plays. So when we start asking questions, okay, what system in your body would control, let's say, digestion? That's the digestive system. Yeah. So what controls, for you to be able to get up off a chair and walk? Okay, it's your musculoskeletal system. You're doing this. What about when your body's trying to fight an infection?
Right, the immune system.
So now we have our immune system. And so we could kind of categorize all these amazing things that happen. But then, well, what system controls all those other systems? Well, that's your master computer. That's your nerve system, your brain and spinal cord, your central nervous system that controls everything. But this is probably the question that's probably people are not sure about is, okay, well, now we have all these systems, and now we're dealing with COVID, we're dealing with all these things, we're dealing with stress. So now, what system in your body now helps you adapt and basically navigate stress?
The nervous system.
Right.
And I think most people probably didn't even realize that there's a system in our body that helps us deal with stress, right?
Right.
I don't know if anybody's ever put 2 and 2 together. We've never been presented that information before, that, oh yeah, I have to deal with my stress, so there's a certain system in our body that's going to deal with stress. We know how to try and manage stress, right, with exercise and so on and so forth. But stress has the direct effect of, or it is dealt with by the nervous system.
And that could be a good and bad thing. So when we're under chronic stress, then there's a chronic stressor on our brain and spinal cord. And it can get to the point where it affects your digestion, it affects your sleep, it affects your immune system, it affects your muscles, everything's tight, and because there's a chronic level of pressure and stress. And your body's trying to do the best it can with the input that it's been given. So the environment that you're kind of giving it, that's how it's responding to it. And that's where we have to be, let's say, with our educated brain, kind of smart and go, okay, I'm putting myself too much in these scenarios. I need to understand how to minimize those so that I could decrease that pressure and stress on my nervous system.
And I think probably the easiest analogy, and at this point it's becoming more and more common to use the analogy, is the fight or flight response, right? Yeah. To understand how stress affects the nervous system. But the fight or flight meaning when we're under that stress response, you think about the tiger that jumps out of the bush, or some crazy beast that jumps out of the bush and the caveman has to run away. Right. Well, that stress response shuts down things like the digestive system. It shuts down the reproductive system, right? It shuts down your ability to focus, because the only thing that's important in that time frame is to pump muscles to your blood, right? And have your brain be like super alert on little details for only a couple of seconds at a time, so you can run as fast as you can or try and fight this thing to survive. Yeah. And what happens is, what you were discussing, that chronic stress response is, if we're in that type of environment chronically all the time, well, what happens after a while is those other systems begin to shut down, such as your immune system, your reproductive system, your digestive system, because you're not needing those systems to be able to fight or survive the tiger. We just need to pump blood to the muscles to be able to fight or get away.
And that's why sometimes patients come in and their initial concern may be headaches, it may be tight shoulders, tight neck, because of that extra stress and pressure, but they're also dealing with digestive issues. They're also dealing with sleep issues. They're also dealing with reproductive issues. And it's not that, they have a bad body or they got a bad model. It's their body is not able to function, heal the way it was intended to in the first place, right? Now, we have an understanding now the nerve system is key for us to be healthy,
yes.
right? So now we go, okay, great. Just like if we had a valuable thing in our house, what do we want to do with that valuable thing? We want to protect it.
Yeah.
So what protects our nerve system?
Well, the main part of it, or I should say the top of it,
Yeah.
like you always tell patients, we got a built-in helmet, right?
Yeah.
So your brain, which is kind of the master of the whole thing, sits up in our head inside of a heart-encased skull. The only organ in the body that's entirely encased in bone, because we want to protect it. It is extremely important.
Yeah.
And then from the brain continues down as the brainstem and then the spinal cord. And so that spinal cord runs inside of the spine. And so our spine's job is, yes, to hold us upright so that we can move and withstand gravity. But as importantly, or more importantly, its main job is to protect that valuable organ called the brainstem and spinal cord.
Right. So our spine is essential for protection. So we think of our spine as, okay, well, my spine hurts,
Yeah.
or my spine helps it. But the number one job of your spine is protection.
A great analogy I heard was a suit of armor.
Right.
It's the suit of armor, right? You think of the knights popping on their armor when they would go into battle to protect themselves. Well, your
Yeah.
spine is the same thing. It's a suit of armor to protect the nervous system. But yes, because there's so many nerves, it's such a sensitive area, it does lead itself to break down and having a lot of pain and associated symptoms that we see people for. But I think that's often kind of on the forefront of people's brains, but we always overlook the fact of, okay, the spine might hurt, but what's the good stuff that's running inside that's as important, if not more important, than the pain that's going on?
And that's why, because the spine is protecting the spinal cord, we need our spine in the right position, upright. It needs to have those flowing curves where we want them to enable everything on the inside to work. Right.
And what's interesting is when people come, and they might come for back pain and they have bad digestion, we start working on them, their back pain gets better, but then, they also say when we do a re-exam, hey doc, by the way, my digestion is better, I don't have diarrhea anymore, my IBS cleared up, right? Yeah. And that's because of that forgotten link that people often don't associate with the spine, is the function and protection of the nervous system.
Right. So now we have that understanding, but now we have to come to the realization is that would be in a perfect world. We would have our spine in the right position, a proper function, proper healing, we're healthy, we're happy, everything's going well. But one thing we have to understand is life stressful?
Absolutely.
So life is stressful. How does that stress, and what form of stress would now impact our body? So we usually refer to as the three major kind of forms of stress. We have, physical, chemical, emotional pressures and stresses. So explain to us a little bit about the physical stresses that we may be under, because I think that's probably the easiest part for patients to understand.
So the physical stress is, number one, gravity is a physical stress. Gravity is a physical stress on your body that's constantly trying to, we'll say, push you down or break you down, right? And we need to always withstand gravity. That's number one alone, right? And then our other stresses could be big traumas, such as slips, falls. People think of car accidents are typically the major ones, big sporting injuries. So we think of large impacts where people feel pain or are immediately injured after. The other one that's as important, if not more important in today's society, is micro trauma. So little things over time. Bad posture. So, your head stretched forward all the time, constantly stretching the ligaments of the spine to the point where, the spine loses stability and starts to change shape and break down.
Now, we've had a ton of people, in the last few months come in with issues. And one of the reasons is mostly because of micro trauma and also emotional trauma, but they're working from home, they don't have their proper setup. We've got more kids on their devices, head down, they're on these bad chairs, bad setups, and now that's creating massive extra stress on the spine, which is now relating to all these other symptoms that they're coming in with.
So physical stress being the primary one that everybody thinks of. Another one that we probably is the least well understood would be chemical stress, right? But chemical stress is a very easy concept to understand as we'll think about nutrition, right? Nutrition breaks down into chemical components. We could think about it as chemical stress when we're not eating the right things. Foods that have all kinds of food coloring, additives, trans fats, high sugar, all of these things create different responses in the body that can heighten our pain, heighten breakdown, heighten the inflammation response to cause, a sequence of problems that will continue thereafter.
Which will then affect the muscles, the ligaments, the joints, which will then cause instability in the spine. So
Correct.
Usually for chemical, it's usually either too much of something or not enough.
Yep.
Right? So we got too much, let's say, chemicals, too much things that would cause inflammation in our body, and not enough good things to help to balance that out.
Exactly.
Yeah.
Okay.
Now the last one is emotional, which is, and then people say, well, how does emotional stress cause things to break down? Well, just think of it. When you're going through a lot, what happens to the shoulders? What happens to our body language? What happens to our spine when we're sitting in traffic or we're going through a lot? Our muscles get tight. We're stressed. We've got this blood flow rushing to our bodies, like you talked about that fight or flight. And so now our bodies are stuck in that position, and it could be for days or weeks or months. And now we're just increasing that stress, causing headaches, neck issues, back issues, increased pressure and pain all over the body.
It's unbelievable the role that the mind plays, and I think in terms of science, it's still probably the least known, the least well understood.
Yeah.
But right now, I think we're in the era of understanding it more and more, and as more and more studies come out, it is fascinating. But the simple way to think about it is, I don't know how often you've heard it, but a patient will go on vacation, not this year, of course, because of COVID, but in previous years, they've been complaining about a back that's been hurting for 6 months to a year. They go on a 2-week vacation, they're like, doc, it's the weirdest thing. My back didn't hurt a minute while I was on vacation, right? Why? Because that emotional stress. And they talk about, well, I went back to work last week and all of a sudden my back started hurting again, right? All other factors the same, and that emotional stress plays a huge role on what people feel and how their nervous system responds to stress.
Without a doubt. So yes, life is stressful.
Very abnormally stressful.
Without a doubt.
Okay.
Now, great, we have stress, but how does that stress affect our body? Specifically for us, what we do, and yes, there could be different avenues, but for us, what the stress that causes on the spine, that's what, as chiropractors, we call that a subluxation. It's a big fancy word to mean there's pressure and stress on the spine causing things to break down and interfere with that communication between the brain and the body. So the best way I could explain it is for people to understand is you've got your Wi-Fi system at home. For whatever reason, that's the worst thing that could happen to my kids is if their Wi-Fi is down, because now there's a lack of communication between kind of your service provider and your console, your phone, your TV. So now there's no gaming, there's no Netflix, there's no TV, there's that breakdown in communication.
Interruption.
Now that's a massive breakdown, but imagine now that instead of having 5G kind of or whatever capabilities, now you're back down to, let's say, dial-up internet. So can you, let's say, download an app with dial-up internet? Yeah, you could. But will it take forever? Yeah. But now think of that as for your body. So now your body's trying to have this information that the brain's trying to give it, but it's just trickling down. So now our bodies are used to fastly adapting to different things that are going on, but it can't do that at that speed. So now it doesn't have the information it needs to function well, heal well, adapt throughout this time, and that's when things start to break down. Now another way of that's, let's say, your organs, your muscles, your tissues, but just think of it even as a joint. If you have a joint, let's say muscles or ligaments around a few vertebrae in your back, you go down and pick something up, but there's not the proper kind of handling of that or stability, meaning that, okay, this muscle you need to fire, this muscle you need to relax, this you need to stabilize. If you don't have that sequence perfectly, that's when injuries could happen.
And it's so unbelievably complex. It's more complex than most people realize, that sequence for just the musculoskeletal stuff, right? They call it like the functional units. I mean, the thousands and millions of little signals that are sent from your brain to every single cell in your body constantly is more than we can actually understand and comprehend.
Right.
Yeah.
So that stress affects what we call these subluxations. And then we go, okay, well, what does subluxation cause to me? Right? What would a subluxation cause to my body? Well, the easy way is breakdown. Yeah. Does that mean that you would feel that breakdown right away?
Not necessarily.
Not necessarily. It could be immediate, but it could also take months or years to develop, meaning that we think of it as a car accident. Sometimes somebody could have an injury after a car accident, but not feel symptoms for months or years later. But those symptoms could be anything from headaches, neck pain, back pain, to sciatica, to digestive issues, reproductive issues,
heart palpitations,
immune system issues, sleep issues. It could literally vary.
Issues, yeah.
Everything is affected when our nerve system is not functioning, healing properly.
And really, it depends too where the dysfunction is in the spine.
Of course.
Different areas will cause different symptoms, different problems, right? So the neck is going to have a lot more, we'll say, problems around, the head, eyes, ears, nose, throat. Mid back would be more of the digestive organs, chest, lungs. Low back, we're going to see more pelvic, reproductive, and sort of pain into the legs, numbness, tingling in the legs.
Yeah, think of it like a panel in your house, electrical panel. Different breakers go to different areas. Same thing for your nerve system, right? So this is maybe more specific, but what specifically for you are causing these subluxations? Meaning that what are you doing, or what are the stressors that you're specifically doing? And that's what we usually address with patients, individual patients, when we first take a look at their x-rays and we've gone through their history, they're trying to understand what kind of stresses their bodies are under. But is it mostly for them they're being too sedentary, they're sitting at their desk for too long, their posture is off for too long, they don't move or stretch enough, their nutrition, their stress, their sleep positions, it could be a wide, huge, kind of different causes. But that's where specifically, and I hope that every patient could kind of even look that into and go, okay, so specifically for me, how's my work position? How's my sleep position? How's my sitting position? How's my posture? How's my workouts? How's my nutrition, right? All of these things are affected, and we would just want to do obviously the best that we can.
And I think once we've done an exam, Dr. Dan, and oftentimes when we find these problems, we'll take x-rays so we can actually see where these specific problems are in the spine. When patients review that with us, so many times they have aha moments. Mm-hmm. And those aha moments are because they are figuring out in their brain, as we're going through things, they're starting to see right away, even the second day we see them, what's causing their subluxations. Because they stop us and be like, hey, is it possible that because I'm sitting at my desk and I'm shifted to the right that we're seeing this kink all over to the right in my spine right now? Yes, right? And so people start understanding these problems that are causing their subluxations, and it's crucial because if they don't understand them, they're just going to keep repeating it, and this breakdown happens over and over and over again.
Exactly, yeah. And then we know, okay, well, how would I know that I have, this subluxations, or how do I know that my spine's not sitting properly? And that's why for us, we go, well, that's easy to answer. Yeah, but you could clearly see that with posture, a spinal exam, and x-rays. Yep. So those three cannot lie. Yep. It's very easy, and that's what I really love about how we go through this with patients is, just like for us, it's not my opinion that I think you have it. You will be also able to clearly see where your issues are and where we need to go. So yes, on x-ray, we have the red lines and green lines. Or, if patients could, remember their x-rays, the red line is where you are, the green line is where we need to go. So if your head is way too far forward and your curve is going the opposite way, yeah, that's a subluxation. That's causing your body not to function, heal well. Now, based on the adjustments, based on the stretches or exercises, based on your habits, based on the traction, we want to get you back to as close to a normal position as possible.
And that's really what brings us to the very last point is, okay, so let's just say you did find out that you have these, what should you do about these? Or how do you know what to do in terms of how to fix them? Right?
And then that's when we go, okay, well, this is what we always talk about patients that almost we call a three-legged stool, right? There's three things that we need to do. We need to, adjust your spine, get your spine moving, take the pressure off the nerves, but we also have to change your habits that you're doing, because if we don't change your habits and you keep doing the same thing that caused this in the first place, you're going to go back to where you were before. And then we also need your stretches, your exercises, your traction, your corrective exercises to get you back to where you need to go.
Absolutely. So, you could take care of one component, you'll get decent results. You do two of those, you'll get better results. Yeah. You do all three, you get exponentially better results, right? We see it through and through all the time. The patients who address all three legs of the stool are the ones that get better faster. They have long-term thinking and they get the long-term results.
Yeah. And these are the 10, but sometimes it's almost a little bit too much for sometimes for us to carry, because we can now understand and know what your potential is. And I'm talking about you, the patient. I could understand and know where you should be, and I won't stop until you're as close to that position as possible. but I also know, like, walking around the streets, you know, going to, you know, walking around the city, seeing, you know, friends or family, seeing, you know, people in other cars while I'm driving, I also see the deficit that is true with most people's lives is stress is everywhere. So if stress is everywhere, it's affecting every single person's life and spine, right? And that's why for us, we are on a mission to help as many of these people, and not necessarily adjust every single one of them, but for me, I see it as my job is to help people understand what's going on in their body and what they can do to help themselves get better and stay as great as they can for as long as possible, right? And that's why we always want, you know, ideally patients help in spreading that message of how their bodies are supposed to work, what people are supposed to do, how should people sit, stand, walk, how should true health be expressed to their body, and that's where we could only do so much.
And I think a big part of that too is you know, and helping people understand this, and we're so passionate about this is because we've seen the people who have done this stuff and been under care for years and follow these types of principles, and we see those results in how healthy they are, right? Mm-hmm. And so when someone comes to see us, I think they're thinking, hey doc, adjust me 3 times to get me out of pain.
Yeah.
But when we can explain this to them, oftentimes people choose an absolutely different path, and that's not only just to get adjusted 2 or 3 times so that their back pain goes away till it comes back again, it's teach me how I can do these things to maintain my health long term. Right. What do I need to do to follow this recipe, right?
So hopefully that could help people understand a little bit more, like we talked about, you know, do we truly understand the meaning of health, right? And then if we could follow these 10 principles that we just talked about, hopefully that could help you, you know, get and stay as healthy as you possibly can. So,
and if you have any questions on those, so I know we covered a lot of material there, so if any of those steps are unclear and you're listening to this and you're a patient, by all means, next time you're at the office, bring it up. We would love to dig in deeper on any one of these individual points or topics to help you understand as much as possible about your health.
Exactly. So again, you could obviously reach us here at the office, 204-474-1159, or on the good old web at lindowoodschiropractic.com. So hopefully that helped you, and enjoy the rest of your healthy commute.